Unfortunately, for a majority of gynecologic cancers, there's no way to prevent these cancers except for cervical cancer. We are very fortunate to have screening tests to detect any abnormal cervical cells, which are in the precancerous stage, and hopefully be able to treat it before they progress into cancer. The pap smear is very important. It's usually started for women 21 years old and older, as well as HPV testing that is done along with pap smear from the age of 30.
There are now 2 FDA-approved HPV vaccines which protect young people against the most virulent or most oncogenic types of HPV virus.
There aren't any specific precautions that parents can take to prevent their children from getting cancer. Most kids aren't engaged in activities that put them at high risk for cancer. They're not smoking. They're not living next to high radiation exposure fields. So what I advise parents when they ask me about cancer is to trust yourself. If your child is exhibiting any signs that worry you, any symptoms that just don't seem right to you, trust yourself to know that they're not right and bring them to the attention of your pediatrician.
To detect prostate cancer, a regularly scheduled screening is usually recommended. So this includes a visit to the primary care office where neuronal symptoms will be assessed, and usually a blood-based test called a prostate-specific antigen should be tested on a regular interval. As for the prevention, there are really no data that's out there that is convincing enough for us to say that this approach or that agent will decrease the risk of prostate cancer. What I do generally recommend to my patients is that living a generally healthier lifestyle will help them.